Yeah.
All right, good morning, everybody. We're going to be going over our live Q&A this week, and what we are going over is estrogen dominance. There's hormone related topic, right? And you hear a lot about estrogen dominance, and and it's like why are these topics important, right? And it's very common to hear or see the things that are happening out there, and as far as health wise, and we're not getting to the root causes, and we're just treating the symptoms or cause, calling like estrogen dominance the cause of the problem, and where it's more of how the body's adapted. And we've got to ask questions and test people about why that's happening, and don't just call it the cause. And so, estrogen dominance is something that I see a lot, and it actually happens in both women and men. And so we need to be able to recognize this better, because there's some big risk factors here that you got to be aware of when it comes to hormonal issues, but then also things around estrogen, testosterone, because these hormones are anabolic. Now, what this means is that anabolic is these hormones build stuff. So they build cells, they build tissue. Kind of think of it like, weightlifters, people in sports maybe that have taken steroids, and what does it do to their muscles? It makes them bigger, right? But these anabolic hormones will cause cell growth, and so that's why the risk factors of having something like estrogen dominance is going to be things like breast cancer, uterine cancers, fibroids, endometriosis, polycystic ovarian syndrome. So all of those are about cells that are building, and building tumors and or cysts on the ovaries. And what we got to get and recognize is that that's not the cause of the problem. Like that diagnosis isn't the cause of the problem. It's the name that we apply to the presentation, that like how the body has adapted, and so what has manifested basically in the body. So we've got to understand there's some major risk factors here, and unfortunately there's a lot of people who are suffering and are dealing with these type of conditions and symptoms and problems. And so I want to help people not get there, right? And if they are there, get to the root causes, because fundamentally I think too, one of the big time problems here that we have in our healthcare, quotation marks, healthcare system, is that we are treating these hormonal dysfunctions with more hormonal treatments usually. Okay, and so the thing is that hormones are not a primary cause; they are a secondary cause. And an easy way to remember this is that if your body's stressed out, in fight or flight is what it's called. Think of it like if you're getting chased by a bear, your body's hormones are going to change. And if you keep getting chased by a bear, the body's going to adapt and change and cause degeneration, basically. So think of it like, I always call them cavities in different parts of your body, just to help you to keep it simple, because it can be a little bit complex. But the cool thing about this, in a way, is that there are patterns. There's established patterns about how the body adapts, and you get a choice to either work with those patterns or manipulate those patterns through therapies and drugs, which can save somebody's life. And I have no problem with that whatsoever. But if that's the solution forever, now we've got issues, because we've never addressed the root causes. And so that's why I love functional medicine. That's why I'm a functional medicine doctor, because I enjoy getting to the root causes, right? Like, I don't want people to just be treated and maybe their symptoms go away, but still they're at risk. That's dangerous. And I've been there myself. And that's what helped me to realize and understand how to not do that. And so that's part of my intention of why I do my Q&As and getting more information out there, is I want to inform you and give you a true perspective that includes treatments, but then also root causes, so you can have the whole perspective, okay, not just one-sided. And so what we're going to cover today, as promised, is that we're going to be talking about estrogen dominance, and we're going to talk about, number one, we're going to talk about what are the signs and symptoms for both women and men. Number two, we're going to go over what are the most common causes of estrogen dominance, and number three, we'll go over what are the lifestyle changes that you can make right now, like seriously, right now, to start to get out of your life. That is a big part of why people can be estrogen dominant. So let's start to dig in here today. So what are the most what are the biggest signs and symptoms of estrogen dominance? Well, when we look at at women first, right? So I think that this topic is usually, you usually hear it more about ladies. or ladies hear more about it. And so, what are some of the most common symptoms or signs that you may be estrogen dominant? Well, dysmenorrhea, which means a disrupted cycle. Okay, so that cycle is unpredictable. That cycle, you have maybe even have like heavy bleeding. Okay, so like PMS symptoms, heavy bleeding, irregular cycles. You can have mood irritability issues, breast tenderness, weight gain, anxiety, infertility, insomnia. Okay, so these are some of the common symptoms that ladies are having or people are having. And the problem is, again, that these symptoms are being treated most of the time, and then they're not asking why it's happening. Okay, so people are taking stuff to sleep, and they're going through IVF treatments for infertility, and they're not even looking at at why these hormones are changing. And so I'm going to talk again about what these causes are in here in just a minute, but let's just kind of get our bearings here again of like these are signs and symptoms that you may be estrogen dominant. And for men, guys, yes, men, I see lots of men who are estrogen dominant. Okay. And what happens with them is that you see a lot of increased belly fat, especially around the midsection. You see low energy, low sex drive. You get the erectile dysfunction, low muscle mass, mood and brain issues. So they get a lot of brain fog. Lots of lack of clarity. They're losing the attention to detail, and then they can also get gynecomastia, which is the growth of breast tissue. And and then something that you see too is like that they can become more sensitive, right? So maybe they cry easier, where they are like, I would have never cried like that in the past, right? So you start to see some of these different signs and symptoms. But if we just keep treating the signs and symptoms and not understanding root causes, we're going to continue to have problems. And we're going to continue to neglect our bodies in a way that it'll continue to develop into bigger and bigger problems. And that's why I talk about these risk factors. And, one of those risk factors for men is going to be prostate things like prostate cancer. Also, the hypertrophy, which is swelling of the prostate as well. And so there's lots of men who have those things. They're treating them with medications, which is fine for a minute, right? For a little bit. But what's the root causes? I want to keep drilling that into your heads is that just because you take a BPH medication, a prostate swelling medication, does not mean that you've solved the problem. And it's not. And if that doctor's just saying, well, that's just common for your age, that's not good enough. Okay. It might be common for somebody that age to have an issue, but it doesn't mean that it's normal. And that's a very important concept to realize. Okay, so what we're establishing here is that, yeah, there's these signs and symptoms, and don't just try to treat the signs and symptoms, figure out why it's happening and listen to them. Figure out root causes, because if you don't, it's going to get worse. And I mean, that's just how the body works, right? Like if you keep neglecting it, it's going to keep getting worse. And so, that's just a true statement, right? So what we want to do here is understand that these are the signs and symptoms. And I think, again, you got to remember there's patterns to the body. There's patterns to hormones. There's patterns to hormonal dysfunction. And in an estrogen dominant pattern, one of the most common patterns is that it's not just that you're producing too much estrogen most of the time, or maybe you're using chemicals and different things in our environment that can push estrogen to go up. But actually, the most common reason estrogen is dominant is in its relationship to other hormones, especially the hormone progesterone. Okay, now I'm not trying to be technical here, but I think you need to have an understanding of that. There's something called the steroid hormone pathway. And what that means is that this is how sex hormones are made. They're made in this order: progesterone, that goes to testosterone, which is known as the androgens. And then from testosterone, it goes to the estrogens. Okay, so these hormones always convert in that order. Okay, so they're very predictable. And in between these hormones there's enzymes. Okay, and enzymes, you got to think of they are things that help chemical reactions to take place. Right? Like that's basically what they are, is they help to convert these hormones from one thing to the next, from one hormone to the next, right? And they work in that order again: progesterone to testosterone, also known as androgens, to estrogens. Okay. And so when you know that, and we've scientifically established how this works, and that's I'm so grateful for, is that the doctors and scientists before me who've established all of this, and then you just got to work with it and not against it. Focus on root causes, not just treating the symptoms or even the presentation that you found on a lab. Just because the are high or that they're low doesn't mean that you just do a treatment and call it good. You got to find out why it's changing, right? Because when we're looking at hormones, you got to look, are they being made? Are they being transported basically from the cells that make them to the other parts of the body that need them? Number three is that they have to be used in those parts that they're supposed to go to. And then number four, you have to be able to eliminate the products of usage. Like you think of like the waste products of these hormones have to be eliminated back out of the body. And the term for that's usually called detoxification. I don't necessarily like that term. I like biotransformation because I have a pet peeve about detox and that people should not be doing random detoxes out there. Okay. So, anyways, get on a tangent there. But so we got to understand that there's a steroid hormone pathway. These patterns are very well established. Estrogen dominance, the most common reason is actually that in relative to progesterone, estrogen is too high. And both of these could be in normal limits, like if you look at a lab work, okay? The progesterone could be at the very bottom normal limit, and estrogen's at the very high normal limit. That's still an estrogen dominant state, okay? So this is the most common pattern that you see. And in females that are still in reproductive years, you're still having a cycle. And this cycle, think of it as 4 weeks, right? So the first couple of weeks, the first week is your menses. And this first couple of weeks is dominated by estrogen, okay? And what's happening there is it's called the follicular phase of your cycle, which means that you're building a follicle. The follicle is where your eggs, where the egg is in. It's basically a sac where the egg is inside of. Okay, so that egg and that sac is building, and it needs estrogen to do that. Now, halfway through that cycle, so 2 weeks in, you go through ovulation. So that sac opens up, and here comes the egg to potentially become implanted with a sperm, right? So that's called ovulation. At that point, that sac actually helps you to produce the next phase, which is progesterone, become progesterone dominant, okay? Progestation is what progesterone stands for. Gestation is pregnancy. So that sac helps you to stimulate the progesterone, okay? And so that they're both dependent on one another. The progesterone stimulates the estrogen stimulates the progesterone. And when this gets out of balance, you can see how quickly you can start to have problems. And thank God we could have symptoms that actually indicate this. But again, if we're just treating the symptoms, not getting the root causes, we still got problems. And it's a vicious cycle that keeps happening. So trying to teach you a little bit of the physiology, not to go over your head, just understand that there's these established patterns. And so if estrogen dominance is happening, if progesterone's low and the estrogen's high, why is that happening? What about testosterone? Because testosterone's in the middle of those two. And so let's talk about now that we've kind of talked about these relationships in a way, not to be too scientific again, but just understand that there's established patterns in how the physiology, how your body works. And so let's talk about now why those things would change, okay? So what are the most common, causes really of why these hormones will change? Well, I'd say number one, stress. Okay. Now, when I say stress, everybody always thinks emotional, right? Because that's what we think stress as: work, relationships, finances. Yes, these are stressors and they should be addressed, right? They should be talked about. These are called lifestyle factors that unfortunately I see doctors skipping over. Oh, that's not like there's really nothing you can do about that, right? Like I hear that. I hear these statements. There's nothing you really do about that. So here's what we're going to do. Those things are so important to balance your hormones. We need more life skills. We need more application to how we are perceiving our environment, right? Like how we are adapting and thinking to our environment, because these stressful situations are definitely individual. Because you could take two people in the same scenario, different thought processes. And one that I always think of is like I love working out, and so I go to the gym, and it's actually a stress reliever, right? It's actually what I call my meditation. And so other people, when they think about going to the gym, totally stressed out, right? So same thing, same environment, same activity, different perception, right? So, there's a lot of work that needs to be done that's called personal development, I guess, that you have to understand why you view and manage life the way that you do. And that's a topic for another day for sure. But the point is that there's so much control that you have on that you can address the emotional stress in your life that then therefore dictates, like breast cancer, urine cancer. Like, would it be worth it to address that stress instead of getting that stuff? Of course it is, right? So, but we just have to value it more, I think. Like, think of it like it's that important to address. So yes, we got to address these emotional factors in our life. But when you think of stress too on the body, you also have to think of chemical and physical stress. Okay. And so, those come in the forms of lots of different toxins for sure. And then what I unfortunately in a way see too is that people have organs that have been removed. And so that creates a physical stress. When we neglect our body, think of it like a cavity on a tooth, is that there's degeneration that occurs within organ cells and tissues. And now, instead of that organ functioning at 100%, or those cells in those tissues function at 100%, now those organ cells and tissues are not 100% functional, right? Because they're degenerated, just like a tooth. It's not 100% functional like it used to be. And so then, therefore, maybe you bite on something, you're like, that hurts, right? Or you drink something cold, you drink something hot, and it gives you a reminder that that tissue is not 100% anymore. Right. And so that happens in other organ cells and tissues. And if you don't address causes, that organ cell or tissue can become so bad that it can be removed sometimes, like ovaries, uteruses, right? Also, gallbladders, appendix, tonsils. And, I think people are like, it's just like tonsils is one I hear like, it's just tonsils. But those tonsils are part of your lymphatic system, which is part of your immune system. And if those things are swelling, then it's a sign that you have immune system dysfunction going on. And just because you cut them out doesn't mean you address the immune system dysfunction. Okay. So I'm here to teach you that kind of stuff without taking too much time, I guess. So, so what are we looking at here? We talked about this stress. So you got to understand we've got physical, chemical, and emotional. And, let's dig into a little bit of this chemical stress. Some of the basic chemical stressors, guys: alcohol. Stop alcohol. I don't care. I mean, I have some people who have these wine cellars in their house, and they are definitely invested into wine. Okay. It's a big factor. Okay. Alcohol can cause your body to convert testosterone to estrogen faster, more, however you want to word that, through an enzyme, okay, called aromatase. And I say that one because it's talked about more, because in breast cancer, some of the treatments that are available are aromatase enzyme inhibitors, which basically blocks that testosterone from converting estrogen, or reduces that conversion, okay? And then therefore can potentially drop that estrogen production or estrogen pool in your body. So alcohol is definitely something that converts more hormone to estrogen, and it also stresses your gut and your liver, okay? And when you stress the liver, what it can do is it can shut down and slow down your body's ability to eliminate hormones out of your body, okay? And so, because again, there's estrogens in there, you got two phases of detoxification that happens within your liver, and the alcohol, it affects those in a negative way. And I always think, it's called intoxicated when you drink too much alcohol. It's toxicated, right? You follow me there? You don't want to put these toxins in there, especially if you're already showing estrogen dominance problems. It's got to be addressed. Excuse me. People what happens again, if we come back to the emotional stresses, I see people using alcohol as a way to deal with life, right? And stressful days, all that kind of stuff, and it just kind of can take the edge off. But see, it's a vicious cycle that goes back and forth, that you have to increase and establish a better mentality around life. Coming back to this personal development thing again a little bit, but then find more productive ways to deal with life, right? And so alcohol, highly important. Okay, I have to stress that, highly important. And something, see, we're talking about changes. Make that change right now. Make it right now. Draw a line in the sand, say don't do that. Okay, and even if it's wine, okay, don't, like, no. If you're already struggling with these hormone problems, cut it out. Okay, I would say even if you aren't struggling with these hormone problems, cut it out. Right, your health is way too important. It's your greatest asset. So treat it that way. And so alcohol is definitely something you can do right now. So that's definitely a toxic element that you can do right now. Another one that maybe is less familiar is called, they're called xenoestrogens. Okay, now these are chemicals that are found in our environment that mimic estrogen. Okay, and so then they can build up in our body and show up as an estrogen dominant state, because again, these toxins will affect your liver, they'll affect your gut, and your ability to detoxify as well. So not only are you putting more estrogen like chemicals into your body, you're also affecting your ability to eliminate them out. So think of it like, excuse me, like a sink, where you're opening up the faucet more, but then you're also plugging it more. Okay, so then the estrogen can pool up in there. All right, and so again, estrogen is an anabolic hormone that will cause cells to grow, and so you don't want a big pool of estrogen in there. You want the right amount, right? So these xenoestrogens, they're chemicals that mimic estrogen. And some of the biggest places that we get these xenoestrogens are plastics. So that's why you hear about BPA, the bisphenol A, that's in plastics, that you want to get things that are BPA free. I would say you just want to get away from these plastics. So if you're drinking water, even out of a BPA free water bottle, that I would say move more towards the metal, so the stainless steel or glass, okay, to eliminate those toxins again. So these xenoestrogens, they're also found in pesticides, guys. So pesticides, that's bug killers, right? And so that's another place to look. What are more healthy ways what are other healthy things to use to kill off bugs? And there's all sorts of different recipes, if you'd say, out there, and I'm not going to go into that today. Now, another place that we get xenoestrogens are in our beauty care products. So, ladies, you got to really look at your makeups, your lotions. Lotion's a very common one. That basically, think of it this way. Here's the principle: is that if you can't eat it, you shouldn't be putting it on your skin, really. Okay, because when you put it on your skin, you absorb it, right? And just like if you were eating it. So you have to be very careful with this. So this is a very common area that ladies get more xenoestrogens and can create an estrogen dominant state. But then you think of them also, they are toxic. So then they affect your ability to detoxify too. Okay. And so so the xenoestrogens, they come in these different plastics, pesticides, beauty products. And so those are some things that you can change right now. And if you have some beauty product, if you want to find out more about beauty products that are better, there's a website called EWG.org. Okay, so this is Environmental Working Group.org. They are a great resource for things like toxicities, and then also pesticides, herbicides. And every year they do something called the Clean 15 and the Dirty Dozen. So they're looking at what are the most, the vegetables the vegetables and fruit that you definitely need to get organic, and then the ones that you might be okay with, we're getting more conventionally grown. Okay, and I say might be because I would just prefer everybody to do the organic or grow it yourself and don't put a bunch of stuff on it. Because that's our best option right now. Okay, so you just have to consider those things, because those are things that you can change right now. So again, Watch out for the xenoestrogens, beauty care products, big ones, pesticides, big ones, BPA, so the plastics. So get away from plastics. Then what else did I say here? So, um, oh, alcohol. Okay, so definitely take out the alcohol. These are big time problems. One of the other factors that alcohol creates, and this is another cause of hormonal dysfunction and imbalance, is blood sugar dysregulation. So imbalance. Okay, blood sugar imbalance. In the stress response, our body prefers sugar for energy. So it automatically shuts down insulin. Okay. So insulin's one of its biggest jobs is to take sugar from your blood and take it and put it into cells. And so in stress response, like if you're getting chased by a bear, sugar is more of a priority for energy because it's quick. It's easy to break down compared to fat. Okay. So when you're in this stress response from physical, chemical, emotional stressors, it will make you more of a sugar burner. Okay. And so that can lead to metabolic problems that you hear, like insulin resistance. You hear about, pre-diabetes, diabetes, type 1, type 2. Type 1 is more, autoimmune related. So there's a big immune system component to that as well. But either way, insulin resistance or blood sugar regulation issues are a big driver of why hormones change as well. Okay, so that's another one. Okay, so we got to calm down the stress response. And then this is why you hear so many people, so many doctors talking about reduce your sugar load. Okay, and so all of the refined sugars. So that's going to be everything, that's like boxes and bags. You see these added sugars, the cakes, the candies, the cookies, even the gluten-free stuff, guys, like the stuff that's promoted as healthy, gluten-free to dairy-free, that type of stuff can still have a sugar load with it, and it's processed. And so we want our sugars coming from veggies and fruit, okay? And veggies first on that. Those are going to be the best places to get them. And here's a little caveat to that too: is don't be drinking fruit juices, okay? When you separate the juice from the fiber, it actually, that fructose, which is that primary sugar in the fruit, actually puts a big stress load on your liver again. And so here you could be drinking 100% organic orange juice or apple juice or something, and yet it's still stressing your metabolic system and changing your blood sugar and affecting your hormones. Okay, so that's another. These are definitely, write these things that I'm saying down. Alcohol, xenoestrogens. Moving away from these processed foods, even the gluten-free and dairy-free stuff, you got to watch out because there's still going to be a sugar load there. We want natural sugars from vegetable and fruit sources. Okay, so that's going to be some action steps that you can immediately take. Let's see, what's looking at my notes here. Oh, let's talk about this. Okay, so another lifestyle thing to change is that if you have taken some form of hormone replacement therapy, maybe you're taking birth control pills, you're on, or you have like an intrauterine device, something that's implanted that's manipulating the hormones, that's something else to consider removing. Okay. Now, I'm not your doctor. Okay. And this is just advice that you have to talk with doctors with, and if you want me to become your doctor, you got to contact me to do that. Okay, but when you're looking at this situation, this scenario, when you're talking about birth control pills, why were you taking it in the first place? Intrauterine devices, why did you put it in there in the first place? These are questions that have to be answered. And if it was not to get pregnant because maybe you are a young teenage girl, then I can see that in some ways, but what are some other alternatives that would be healthier and safer for your health long term? If you are maybe later on as a woman and you're not so worried about, it's not so much about not getting pregnant, it's more about, man, my cycle's been terrible. I've never had a good cycle. And so it's more about the regulation of the cycle. That's where you've got to establish what the cause is. The manipulation from these different treatments will change those hormones and affect you long term, and will interfere with you getting to where you want to go from a health standpoint, because it is manipulating the body. And if you are a woman on HRT, hormone replacement therapy, And a lot of times this happens post-menopausal. Once a woman goes through menopause, it's very important that you understand what's happening with the hormones. And this is where you get into testing. Functional medicine testing is very much different than standard medical testing when it comes to the hormones. And this is why I do urine testing and a lot of saliva testing when it comes to the adrenals, to establish what we're talking about today and understand how everything's working together, not just what does estrogen look like, what does progesterone look like in the blood. We want to see how it's all working together. So a lot of ladies, and my point here is that a lot of ladies who are postmenopausal, that I see their estrogens are way too high for postmenopause. Your estrogens are actually supposed to be much lower in menopause, and the problem is that because the hormones are dysfunctional, there's other areas of dysfunction in the body that aren't being addressed, that are changing the hormones. It's just a vicious cycle of just not feeling good, risk factors, and so the treatments can help ladies feel better, and then they're like, okay, I must have addressed the cause, but unfortunately it's not. And most of the time I see the estrogens being too high, which again increases the risk factors for cell growth called tumors, breast tumors, endometriosis, all those type of cellular growth things. Okay, um, so those postmenopausal ladies, you got to really look at the testing to establish what's going on, so you're not putting yourself at risk, and reducing your dosages with the work of your with the help of the doctor who's put you on it, of course, and get you to a place of, do you actually really need it, and or if you do need it, are you on the most minimal dosage, because it is the most invasive therapy compared to what I'm talking about here in the functional medicine world. Okay, so there's some questions to ask too, and some action steps to make, really from a lifestyle standpoint, um, to change what's happening for the better, right? And get to solutions and not more problems. All right. So let me get my bearings here a little bit. As I talk, I get off course in my brain a little bit. I think about more things that I want to share with you. Let me. This is with this. Okay, so therapies. Now let's go to men real quick. Now, when guys, what happens with men is that their testosterone's is draining, and a big part of that actually is due to, I see a lot of alcohol, so beer drinking happens, and so that drains testosterone to estrogen faster. Gut health, guys, this is such a, for everybody again. Gut health is a huge part of this. Okay, so if you have hormone problems and you've never tested and taken care of your gut, so very specifically, you're you've missed a huge piece of the puzzle. Okay, and so for guys, the gut, the alcohol, the draining of testosterone to estrogen that takes place because of alcohol, because of a lot of sugar, which alcohol has problems with too. um, Gut issues, it will drain the testosterone to estrogen faster through that aromatase pathway. Now what happens there is that guys hear about the testosterone treatment therapies, and so they'll do is that they will go get those treatments, and so they establish more testosterone into their bodies. They don't change any of their lifestyle. That testosterone converts into estrogen again. Always does. It always drains into estrogen. So it's a vicious cycle. Like, you can feel better for a little bit, and then you have to go get another injection, or another treatment, because that's going to wear off because you're draining it into estrogen again. So it's a vicious cycle over and over. But then, men, gain weight. They are moody, right? They're emotional. They're might have some heart problems and metabolic problems that are being established, and that has a hormonal component to it, but it has a huge gut component to it too. So when you look at those therapies and how the hormones are converted, we got to address those things that cause those hormones to convert faster or not detox as well. This is done through functional medicine testing. I mean, this is what I do every single day to find out where is everything, and then what do we need to change lifestyle wise. What parts of your body are degenerated, like cavities in your gut, cavities in your hormones, hormonal tissues. What are the areas that need supplemental support? Very specifically, hypernutrition, meaning over nutrition. That's what supplements are, is concentrated nutrition. so we can get to those root causes, support the body in their its weak spots, and understand that when we do that, the body's set point is actually normalization. Like I would say, if you hit your head on a table and split it open, that's not the cause of the problem. You can treat it with medicine or something natural and keep hitting your head. So the symptoms get better, but you're still hitting your head. So you still got the problem happening. So if you stop the treatments, this comes right back again. What's the solution? Is stop hitting your head. And the point there again is that your body will heal that up as soon as you stop hitting your head. I just want you to know that that applies to everything else that you've ever, every symptom, diagnosis, condition, problem you've ever heard of. Okay, your body is working for you, not against you. So, so let's see here. So let's summarize. We've been going, quite a while here today, and so here let's summarize. Is that what are we talking about? Is that there are hormonal patterns when it comes to estrogen dominance, but then also other topics around estrogen. Signs and symptoms that you may have estrogen dominance, again, when we're looking at, men and women, both, for women, you got dysfunction within your cycle, you got heavy periods, PMS, mood and irritability issues, breast tenderness, weight gain, anxiety, infertility, insomnia, which those last three, the anxiety, infertility, insomnia, actually have a lot to do with because the progesterone is low as well. Next thing is that men, they have, if they're estrogen dominant, you see increased belly fat, low energy, low sex drive, erectile dysfunction, low muscle mass, brain fog issues, gynecomastia, which is breast growth, right? So these are signs and symptoms. The risk factors, again, are things like around cancer, right? So whether it's you got breast cancer to the uterine cancers, fibroids, endometriosis, polycystic ovarian syndrome. These are all things connected to estrogen dominance. So the point on knowing that, again, is don't just treat those symptoms, listen to them, and you got to understand that you got to get tested through a functional medicine model in order to get to the root causes, because many times, like I've been talking about tonight or today, I guess it's this morning, is that there's a ton of things that cause the hormones to change, and the hormones are more of a secondary problem than a primary problem. And let me just put it in your ears, the gut is a big part of that problem, and it's because of the stress response, blood sugar and metabolic regulation, the toxic load, and our ability to eliminate those toxins. These are all huge factors. And if you're not analyzing them very specifically and comprehensively, meaning all together, then you're gonna have blind spots, and it's gonna be hit and miss. And you do not want to be hitting and missing on your health, your most important asset. So those are the signs and symptoms. Men and women both are being affected by it. The lifestyle factors that, you really, like really the things that are most commonly causing these hormones to change is gut health, metabolic changes in the blood sugar, which has a lot to do with the stress response. Again, think of it getting like chased by a bear. Your body wants to use sugar for energy because it's quick and easy. It doesn't have time to break down fat. Okay. And so the metabolic systems, blood sugar, detoxification systems, again, which has a lot to do with your gut. The lifestyle factors that you can change right now, stress. Okay. You need to deal with your emotional stressors for sure. Okay. Whether work, relationships, address them, confront them, find ways to meditate. Okay. And that doesn't mean that you have to sit cross-legged making om noises, right? One of my biggest meditations is working out. Okay. Or at least being active, right? Whether it's a hike, going for a walk, just being out in nature. It's a good way to counteract those emotional stressors. Start there, start simple, and then start to look at things around meditation and different programs around meditation. It's really a very important lifestyle tool to address, because we're not going to get away from stressors. We have to change the way that we view and manage our life, because we all can think differently in the same scenario. And from there, also practice calming down. Okay. So that's a very important one. A big lifestyle factor to change is cut out alcohol, period. And again, the reason that a lot of people are drinking alcohol is to deal with life. And so it's the way that they're masking their problems and dealing with it. We've got to be more productive and not destructive with our coping mechanisms. Okay. And I would say that's the same thing when it comes to the foods, right? We talked about foods that we want to get away from the packaged, processed, that has a lot of sugar in it, even if it's gluten-free, dairy-free type stuff, it can still have a high sugar load. We want our sugars coming from vegetable and fruit sources, natural sources that aren't processed. We don't want to be drinking fruit juices, okay, because it separates the fiber from the fruit, from the fruit juice, the fruit sugar called fructose, which puts more stress onto your liver, your digestive system, and creates more inflammation, more stress response. Okay, so that's a very easy lifestyle hack right there. Don't drink fruit juice. Eat the fruit. Okay, fiber is very important. Get 25 to 35 grams of fiber per day. And that's a huge way. That's something that really supports your digestive system and also the elimination of toxins. So that's why also we want to be eating the fruits or the veggies and then the fruits. All right. So that's another big one lifestyle wise. The next one is the xenoestrogens. These are chemicals that mimic estrogen that put stress on our body, that can affect detoxification as well, which allows estrogens to build up as well. So xenoestrogens come in many different forms, from plastics, the BPA plastics, but I would just say get away from the plastics, stainless steel, and glass containers for your water, for storing food, both. Next one is that we have them in pesticides. So don't be using harsh pesticide chemicals around your house. Next one is going to be the beauty care products, makeups, lotions, skincare products. A good rule of thumb is if you can't eat it, you should not be putting it on your skin, because when you put it on your skin, you absorb it just like if you were eating it. All right. And there's a lot of resources around there, around those products these days that that makes it easier to work around. And the last thing I think on that too is with toxins, estrogens, is your hormone replacement therapies, your birth control therapies. You've got to really consider, what are my alternatives there, and what's the long-term effects of me taking and using these things. If you're postmenopausal and on HRT, hormone replacement therapy, you better get tested through the urine and saliva instead of the blood, because you've got to really understand how those hormones are converting. But I just say postmenopause because I see way too many high estrogens in postmenopause on hormone replacement therapy. And so you don't want to be at risk, right? So that's the point of that. All right. So I've gone through a ton of different information here today, taken, 45 minutes of time. So come back to this, and, on YouTube is a great place to come back to this and listen to it in parts. Pick out these different things of, why is this important? Look at steroid hormone pathway, understand that estrogen, progesterone, testosterone, these are all working together. Get some more information around that. I'll be talking about this more and more, because this is what I do all the time. And this is part of why people are so sick. And so that's my intention of doing the live Q&As, is to get more information out there, more access, more understanding, and more awareness around functional medicine. And there's a whole different level of testing that people have never even heard of, because it's not within the medical model, the standard of care. Okay, that standard of care is more for emergency care, actually. And the treatments and therapies are more around that. They're not addressing root causes. That's the major premise of functional medicine, is to get to the root causes. So let's wrap up here. So what I'll be doing is I'll be doing another live Q&A next Wednesday. I'll let you know what the time is going to be. Today we did 8 a.m. I've been doing 12:30 p.m. a lot of times. So just look out. I'll be posting that on social media, so look out for that. If you have questions, email me at info@drgunyon.com. That's info@drgunyon.com. You can direct message me here on Instagram, write comments, whatever it is. Get the communication going. I will help you as much as I possibly can. And if you're interested in getting into you or someone you love hear about tested in functional medicine and getting to the root causes, let me know that as well. All right, guys, have a great day. I'll see you soon.